If I didn't stop everything I was doing, I probably would have dropped dead at the gym.
The young man who faced his second life-threatening medical condition before the age of 30, see the procedure and hear from the surgeon who saved him while stopping his heart for 4 hours. That's today on All Things Heart. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Luke Harbour and his mom like to say he's getting a second chance at life for the second time. And he's found trust and hope in the team here at the health system that saved his life.
I'm just amazed at how quickly I've recovered.
One of the things you'll notice when you speak with Luke Harbour is the peacefulness that emanates from him even after open heart surgery.
Really, it is a miracle what our body does to adapt, and you just have to deeply listen to it.
But when we first meet Luke and his mom, Kim, it's just a few days before this, and the stakes are sky high.
If he doesn't have this procedure, it's a fatal situation.
Incredibly, this is not the first time Kim has been told this about her son.
Oh, goodness. And they told us at 5 months old that he would need a liver transplant. And if he didn't get that liver, he would die by the time he's 2.
At 11 months old, Luke got that liver transplant. And for the next nearly 29 years, he was great. Graduating college, traveling the world, and embarking on an entertainment career as a singer, songwriter, producer, and performer. But in early 2025, Luke noticed a change during his daily exercise.
There's just something in me that's a little off. Like my breathing technique is really off. I feel like I get really tired now about 10 to 15 minutes in.
He went to the doctor and the tests and scans revealed something alarming. This time it had nothing to do with Luke's liver. Luke had a large and growing aortic aneurysm.
What's happened is the aorta, the bottom portion, the root, has ballooned. And it's asymmetric right now.
And what can happen in an aneurysm is they can rupture, and when that happens in the heart, then it is fatal very quickly.
And then you can see this asymmetric bulging down here. That's the aortic root aneurysm.
The only way to repair it, an incredibly complicated 7-hour surgery.
For 4 hours, the heart will be stopped.
For 4 hours?
For 4 hours, they stop the heart. You know, they clamp it, just like in a transplant. They clamp it, and then the heart stops for 4 hours.
And the surgeon to do it? Cardiothoracic surgeon Dr. Todd Crawford. And Kim and Luke were comforted to learn that when Dr. Crawford was just a couple years older than Luke, he underwent the same surgery.
I feel just so grateful that there's someone like Dr. Crawford here at the University Kansas Health System.
We asked Luke how he's able to stay so calm talking about it.
I have a lot of therapy and meditation background, and that has just helped me immensely.
He says it's because of his big brother, Cole, who's helped him over the years.
I really do want to credit him for this because his practices have helped me a lot.
Kim is holding on to her faith that it'll work out, just like when Luke was a baby.
What we're getting ready to experience is a second chance again.
After the surgery, Luke will learn something surprising about his second chance. It was even more precarious than anyone realized.
My descending aortic root was so thin, it was only being held together basically by a single human cell, meaning that I had probably about a week or so to live.
And that made the surgery much more involved.
I don't even know how I can express my gratitude to Dr. Crawford and the care team. I was so close to being gone.
Little did he know, less than 24 hours after this interview, he would need a second surgery to implant this tiny pacemaker into his heart. It's the smallest in the world. And Luke being Luke, the picture of calm, here he is smiling, showing us what it looks like.
Wow. Luke, you are amazing.
Thanks. That's pretty wild seeing all that.
Yeah, I bet. And here you are. How are you feeling physically?
Well, physically, I just celebrated 12 weeks out this past Tuesday. It's a Thursday, and I'm genuinely feeling pretty amazing. I'm already back starting to do some level of performance. My weightlifting restriction just lifted this past Tuesday. I'm going to be mindful about that, Dr. Crawford, I promise. But consistently, I've been waking up feeling like I'm getting back into a sense of normalcy again.
You've stayed so positive throughout all of this. I have never had a patient actively texting me selfies and pictures, and here's the, and Kim is in there texting me pictures of you holding Luke holding the pacemaker, and I can just sense what a special energy that you have, which is why you're also such a great performer at what you do, but you're such a kind person. It comes out of you.
Thank you. I try my best, and I've done some really great processing too. I want to encourage anyone who goes through a life-changing surgery to get therapy, be open when it's difficult, because that is how you really process what's going on in you, to really be positive and see the hope, even through tragedy or difficult times that you might have.
Kim, how are you doing?
Ooh, that video was something.
I have tissues.
Yeah,
I can slide them down to you if you want them.
We're doing good. We had, this came on so quickly that we had a lot to process very quickly. But we're grateful for Dr. Crawford and his team and all those here at the health system that really do what they do every day so beautifully for people like us.
I want to share something that Luke wrote on his Instagram. If you don't follow Luke on Instagram, you should. What's your Instagram handle?
At Music by Skippy.
At Music by Skippy. Well, first of all, you shared a little bit of your beatboxing with us before the show. I think the audience needs to hear that.
Of course.
Can you share some of your art?
Sure. Okay. Here's like a little sample.
Okay.
Yo, skibbity skip. Yo. Yo.
All right.
That is amazing. And you didn't know you were going to be asked to do that until I asked you just now.
Yeah.
I cannot wait to come to one of your shows. After the surgery, Dr. Crawford, you said you and the other team, the whole team, were pulling up videos of Luke and watching him.
Yeah, and I can tell you from personal experience, I was not doing that 12 weeks after surgery. I had the opportunity to watch him perform this weekend, and it's impressive.
Incredible. So I do want to share the Instagram post. You wrote on Instagram, "Fear's greatest enemy is strength through adversity. I'm about to live a quality of life I haven't experienced yet. I am strong, I'm loved, I'm grateful." You stayed so centered throughout all of this, and you attribute that to the work you did ahead of time as far as processing?
Absolutely. So I did something called touch therapy, which really, really helped. Meaning when we went through all of sort of these pre-meetings leading up to this surgery, I was told, where would certain tubes go? What kind of needles would be used where on my body? And so what I tried to do was literally just take deep breaths and touch all the places that were probably going to be different.
Did you get them all, though?
Probably not. I would say no, but I got pretty darn close.
Oh my God, that's so incredible.
It was very helpful.
And Kim, Luke lived with you for the first few weeks after the surgery. How long, and what was your role?
He was with us about 5 weeks. Yep. And I have to really give credit to his partner, Darby, because she cooked she did the whole food prep the whole time, which was fantastic. So I just gave her my credit card, and I'm like, I don't care that eggs are $900, go get whatever you want. Yeah. And so that was really helpful because we were still working full time. We both work full time, so we had to fold it into our daily lives as well. But it was, he's very easy to take care of, as you can see.
Oh, yeah, and entertaining. I'm sure he was trying to do more than he should. Were you trying to get up and...
Yeah, I was very disciplined in working my way up in the beginning, but as Dr. Crawford can attest, and as he probably has to tell many people who get this kind of surgery, your brain starts to get ahead of your body, so you think you can do more than you can. And my one example I'll share is, I was walking around the room for 5 minutes a day near the beginning. And I was like, well, I think I can push for 6 or 7 today. And then I noticed I'd get winded pretty fast.
Yeah.
So incremental progress was a big part of the recovery. That's when I kind of caught myself in what I still do now when I go back to the gym.
Went
Incremental.
easy on it.
Easy on it.
When it comes to the surgery itself, how would you describe an aortic root aneurysm to someone without a medical background?
Yeah. Well, just to even take a step back from that, Luke had a bicuspid aortic valve that he had known about for many years and was followed for.
And what's that?
So instead of the aortic valve having 3 leaflets, which is the normal configuration, Luke was born with a configuration where he had 2 functional leaflets.
Okay.
And we know about 40% of those patients will have aortic dilation or aortopathy. And they can come in a couple of flavors. They can be either a root phenotype, where it's predominantly the root that's grown, or the ascending phenotype, where the ascending is enlarged, or both. And Luke really had a root phenotype. So the root is a very eloquent area of the aorta where the coronary arteries come off.
And where is it in the body, if you had to point to your chest?
So right where the left ventricle exits into the aorta, the aortic root is that first part where the aortic valve lives and the branches to the coronary arteries.
And what does it mean when there's an aneurysm on it? How would you explain an aneurysm to someone who doesn't know what that is?
So all vessels in the body come in many shapes and sizes, and it's not a one-size-fits-all approach. You know, there's certainly variations related to patient's body size, but an aneurysm is a pathologic dilation of a vessel, and so the normal aortic root in someone Luke's size would be around 3.8 centimeters, and his was almost 7 centimeters.
So it was ballooned.
Massive.
And it was at risk of tearing? Rupturing?
Yeah, so the risk of dissection or rupture, which is a life-threatening emergency that somewhere around 50% of patients succumb to, it goes up with an increase in the diameter of the vessel.
And if you're new to the program, watching All Things Heart, you might not know that Dr. Crawford went through the exact same surgery. This is something you've talked about. We did an episode on you about this. Do you share that with every patient you're about to perform the surgery on? That, hey, I had this done on me about, what was it, 4 years ago?
Yeah, 4 years ago.
4 years ago.
I mean, I wish I didn't have that shared experience, but I certainly do. And I think for someone like Luke, and a lot of younger patients, it's just very comforting to have someone that's walked in those, shoes and knows what it's like before, during, after that surgical experience. So,
what did it mean to you, Luke, when Dr. Crawford shared that?
Oh, whether Dr. Crawford likes this or not, I felt like I had a fraternity brother in the room because it gave me this sense of, oh, I'm really going to be understood if I have something I need to share, or oh, if I'm really struggling for any reason before, during, and after. I mean, I legitimately have someone that's like, yeah, I lived that, and I want you to know, here's maybe what my experience was. Take or leave that as an example, and it always was a place I felt comforted by and I could go to as a patient.
That makes complete sense. And then Kim, when you hear that the surgeon who's going to be operating on your son had the same exact surgery.
Well, it's kind of like a built-in mentor, really,
Yeah.
that you have someone that can, because patient-to-patient conversations are very different than patient to physician or surgeon or nurse. And so it is nice to have someone who's walk the walk a little bit.
He can talk patient to patient,
Yes,
and you can
right.
also talk surgeon to patient.
These guys are like, I was watching them, and they do that like brother thing, like
Yes.
they kind of like, they go like that, or they hit each other on the back, or
I love
whatever.
that.
It's very interesting to watch this relationship develop.
I love that.
It's lovely.
Well, we do need to give a quick note to our viewers. We are going to share some surgical images with you because this is a medical show. So if you're not a fan of surgery images, right now would be a good time to look away. We'll tell you when you can open your eyes again. Because Dr. Crawford, one of the things we love about you, among all the things we love, is that you take pictures and videos like these before, during, after surgeries, which are such good learning tools. Luke, is this the first time you've seen this video?
No, it is not. Dr. Crawford was willing to send this my way, and
So great.
I'm amazed by it. I really am.
What are we looking at here, Dr. Crawford?
Yeah, so we're looking from the head down towards the feet. And so what you see there is the ascending aorta, which is the most anterior structure. And that's that big tube. And then you also see the heart towards the top of the screen, which is beating. He's at this point on cardiopulmonary bypass, so we have our cannula in the aorta at the bottom of the screen and cannula.
Sorry, when you say head to the feet, you mean which?
So the head is at the bottom of the
Bottom
screen.
of the screen. Okay,
and
we can put it up again.
Yeah, the feet are towards the top of the screen.
Okay, and what are we looking at there?
So his ascending aorta is relatively normal in diameter, but you can see towards that big tube on the right side, and I'm about to point to it with my Yankauer sucker,
What's
that there
it
is
called?
this, it's called a Yankauer sucker. See what I'm pointing there? That is his aortic root aneurysm, so that, that bulbous outpouching down below the right atrium.
And is it how much smaller? Is it supposed to be the size of those tubes?
I
Like how-
usually can't see it in this view. Yeah.
Oh, wow.
Yeah.
So that tells you how bad it was. And then Kim said you stopped Luke's heart for 4 hours?
I can't remember. It's somewhere around that. So admittedly, the plan for Luke was to save his valve, and that should be the plan in all patients his age with a competent aortic valve. And despite this massive aneurysm, I was amazed that he had a trivial leak across the valve, which means he's got big leaflets that are still interacting well. And so we have more pictures, but we'll talk about why we ultimately couldn't save the valve. But when we replace the aortic root with a valved conduit, it doesn't take as long.
How do you stop the blood flow to the heart?
So you're on cardiopulmonary bypass, so you can deliver blood to the brain and the rest of the vital organs. And then you take a clamp and you place it across the ascending aorta to occlude that flow from bypass coming back towards the heart, and then we also have a cardioplegia cannula that we deliver cardioplegia with.
Oh, we have a picture right here. Okay. So what are you, how do you protect his organs when you're doing that?
So this tube goes into his ascending aorta, downstream near his head.
Okay.
And that actually, we through the bypass circuit, blood comes out the right atrium and then goes back in through the aorta, and we deliver oxygenated blood to the rest of the body. And then when we stop the heart, we put a clamp right there, close it off, and we have a cannula in here so that we can deliver high potassium solution to the coronary arteries to stop the heart.
Now, are you taking the pictures during the surgery? Do you have a person that takes them for you?
This must have been someone up at the anesthesia corner of the room, which is the top of the bed.
One of the other things Luke said during the interview was that his descending aortic root was held together by a single human cell. What does that look like?
Yeah, I don't know if those pictures are available. I have a video that I also...
We have some videos and some images as well, because we're going to give you a closer look at what Luke's aortic root looked like.
Yeah, so this is the reason why we couldn't save his valve. So we took a long time dissecting this free, and you can see this is his aortic root deconstructed and opened up.
Do you need a pointer?
Sure.
Okay.
So here's his left coronary artery retracted down there. His right coronary artery is there. And then we've taken down the sinuses of the aortic root.
What's that when you're
So that's his
opening?
valve. And you can see just absolutely beautiful leaflets, big leaflets, great coaptation or where they meet and interact. But when you do a valve-sparing root replacement or a valve repair, you rely on this aortic tissue, at least about 5 millimeters of it, to sew your graft to. And what you're seeing there is actually the right ventricle coming through the aortic sinuses. It was that thin and translucent.
Wow.
And so we worked a long time to try to free this up, but ultimately we would have either gotten into the right ventricle or into the aortic root. And I did not think it was safe to proceed with the valve repair at that point. So unfortunately, we had to cut the leaflets out, and then we based the valve replacement off of his left ventricle and that tissue there.
And you're just having to decide this all in the moment once you get in there.
Exactly. We had talked
What a
about
great team
our
you
contingency plan, and obviously I need to know Luke's preference for a valve before he goes into surgery.
And how much time did Luke have before it ruptured, would you estimate?
That's really hard to predict. Could be days, could be years. It's, and I tell patients this all the time. We have population data that we use to make decisions on when to operate. But at the end of a year, you're 0 or 1. You either had the complication or you didn't. And, at 7 centimeters, that risk of an aortic complication in 1 year is extremely high.
If it had ruptured when Luke was doing what Luke does, he's a performer, he's on stage, he's working out all the time. If it ruptures, is it fatal? Is there hope if it ruptures?
If it ruptures, it's almost always fatal,
Oh my
because the pericardium is an enclosed sac, and it's such high velocity, large quantity blood that it actually causes something called tamponade, where the heart can't fill anymore.
So because Luke was in tune with his body and knew something was off, did that save Luke's life?
Oh, absolutely. I mean, I think it was, you know, you hadn't had surveillance in a couple years because your aorta had been stable.
Mm-hmm.
No one expected to find that your root had grown almost 2 centimeters
Goodness.
in 2 years. So.
Right.
We have one more surgery image to show people, and then we'll let you open your eyes again. Well, you can open your eyes whenever you want, but we will tell you you can open them after this image. What are these?
Yeah, these are Luke's leaflets. So these are his aortic valve leaflets, and you know, again, pristine, no calcification. We look for fenestrations or little holes at the edges of the valve along the free margin, and Luke didn't have any. You know,
How big, on your index finger, how big are those in real life?
so the
a digit?
geometric height, which is what we measure,
Yeah.
in Luke was probably close to 3 centimeters, 2.5 to 3 centimeters.
So those little pieces of tissue, like this pen cap, like are they about this big, smaller?
Yeah,
How big?
yeah, that's
So about the size of a pen cap?
a little taller, but
Okay.
but yeah, probably about that in length.
Okay, it was so interesting. For our viewers who are okay not, you're okay to open your eyes again. That's what I want to say. If you weren't down for surgery images, you can open your eyes now. What's it like to see those images, Kim?
Well, I had seen some of those images as well, and we watched a video of an aortic root replacement before the surgery. So I just wanted more knowledge. And Luke and I watched it. Now my husband's like, no,
No way.
no.
Yeah.
But we're like, oh, we're all in.
Like, come
So,
on.
you know, we
Come
watched
on.
it. And I found it very, very helpful. I find it fascinating.
Right.
Yeah.
Well, Luke, you said it's part of your therapy.
It was.
The touch therapy?
Yeah,
Was
touch
that something
therapy.
you got here, or you worked with an outside therapist on?
Worked with an outside therapist on.
That's really fascinating. I hadn't heard of that before, and that's
very,
would be such a
very
good
helpful.
tool. We already have some great questions coming in. If you have a question you'd like us to read on air, or a comment you'd like us to share and read out loud, send it to us on YouTube, Facebook, or the All Things Heart email. All the links on how you can connect with us in real time are right there on your screen. Kim, this was Luke's second life-saving operation. You don't remember the first because you were a little baby Luke, but for Mom, holy smokes, as you sat in the waiting room for the second time for a life-saving surgery, what was that like?
Well, part of the process of leading up to the operation and all the appointments we had to have, I have to say there was some triggering back to the transplant. You know, when I hear chest tubes, we didn't have a good experience with chest tubes because after his transplant, we had some issues with the chest tubes, and he had cardiac arrest as a baby. So we've done that. I just say that like, oh yeah, we've done that. Like everybody does
Been there,
that,
done
right?
that, yeah.
And so there were things like that kind of triggered me back, but I had a better understanding of them, so that was helpful. But you just have to kind of go with what's in front of you and learn about it and trust the system, and a lot of it is out of your hands. So.
And you had that trust.
I did.
In Dr. Crawford and his team.
I did. We looked him up a little bit.
Yeah, I bet you did. Did you research?
Yeah, we did.
The pacemaker, Dr. Crawford, why was the pacemaker necessary?
Yeah. Just real quick, you know, I obviously have experience as a patient, but this morning I got experience as a parent because my youngest daughter had tubes put in, and so I can relate to what Kim's saying. I mean, it's you know, on no scale like what you've been through with a liver transplant and open heart surgery, but you know, even the small things, you just have to have faith and trust in the team. And
I mean, hats off. I wasn't going to bring up the surgery, but you did, so we're good. Dr. Crawford is not only he's a surgeon, he's seeing patients, and then he comes in and sits down, and oh, by the way, my baby is in surgery today, so thank you for being here. You're really
done.
Everybody's going through something, right? And baby's fine.
yeah.
You got that text right
Absolutely.
before airtime.
Yeah. So back to the pacemaker, you know, what we haven't shared about Luke's story yet was that it was not all smooth sailing. On postoperative day 3, which is when I typically like to take pacing wires out if the patient has been in their own rhythm and has good blood pressure, we took Luke's pacing wires out. And I visited with him early in the afternoon and said, "You're on pace to get home for the Super Bowl this weekend." Oh. And about 30 minutes later, I was across the street. I got a call that they were doing CPR on Luke.
My gosh.
And so one of the risks of putting an aortic valve in is that you can go into complete heart block because of the pressure on the conduction system, and indeed that's what had happened to Luke in a very rapid onset. And fortunately, within about 30 seconds of getting chest compressions, his heart rhythm came back. We put a temporary pacemaker in, but because his heart had completely stopped, we made the decision to proceed with putting a permanent pacemaker in.
Wow. And will that pacemaker be necessary? Will it have to be there the rest of his life?
So it'll be there the rest of his life. Whether or not he uses it is a different story. He never actually required pacing after that one episode. So I'm optimistic that he will regain long-term cardiac conduction.
We have some really remarkable pictures that Luke has continued to share from his social media account. I do want to get to questions, though, because we're getting questions from our viewers. But let's show some of those pictures of Luke while I take these questions from our community, because I want you all to see this. Jean Raridan says, is the tiny pacemaker battery powered, and will it ever need to be replaced? Will it?
Yeah, so it will. Like a transvenous pacemaker, the Micra is specifically a leadless pacemaker. It does have a finite lifespan. Now, that is heavily dependent on how much you're using the pacemaker. And so, you know, I'm optimistic Luke won't need any more interventions in his lifetime, because I don't think he's going to require long-term pacing.
And on those, if you do need another one, they don't take that one out. They just put the next one right beside it.
Okay.
Because my question is, like, how many beside it's can you do?
Yeah.
Right.
You know, he's going to have like a necklace around his heart pretty soon.
What's the answer to that
So
question?
yeah, but they've kind of said the same thing. He's
Okay.
probably not going to pace very often.
Jeremy wants to know, he said he was moved by your comment earlier about your brain getting ahead of your body. How can you tell yourself how hard to push when you're recovering from a surgery like this? It must be hard. How do you know what level is right?
I think your body is very smart. It's going to talk back to you pretty fast when it knows a limit.
Yeah.
And your brain is going to argue with your body. And you basically have to say out loud, if I'm tired, it's because my body is getting stronger. You have to frame it that way.
I love that.
And that's what kind of allows you to sit down and take a chill pill. Because, I mean, Mom knows, I mean, there was a point where I was walking around the house and I noticed my heart was pumping really, really fast. And I was like, okay, don't panic, calm down. You were told that this would probably happen. Right. This means you need to go back into your, practice, your kind of meditation and therapy practice, that your body is going to continue to progress, and you have to be patient with it because you only got one. You can't ask for the other Luke Harbor body number 2 over there.
Right.
You can't just pull it off the shelf.
Have you ever considered being a motivational speaker for people who are about to undergo life-changing surgeries?
I am writing a book about what has happened, and
man.
I have thought about that, yes.
When that book is ready, I cannot wait to read it, and we want to have you back on.
Can't wait.
As we wrap up this discussion today, I would love some final thoughts from our guests, and I know we're going to get questions throughout the day on this. Luke, I'll start with you. What do you want our viewers to know?
If you are going through any kind of life-altering situation, whether it's medical or non-medical, you have to be loving and patient with yourself in whatever a recovery process looks like. I understand and want to call out that it's a privilege to have a loving community. I'm very lucky I'm close with my family, that I have a phenomenal doctor. I mean, I have phenomenal friends that have been with me through and through nationally during this time. But there is one friend or one person that does love you and wants to be supportive to you. So just don't have any kind of ego about it and reach out to that person, because that is what will help you not feel so alone in a really tough situation.
Kim, you must be so in awe when you hear your son speak about this and see how he's handling this.
Well, it's I agree with a lot that you said. You know, find your support system, understand what you're getting ready to face, and continue to understand the long-term aspects, because with the liver transplant, aortic root replacement, pacemaker, mechanical valve, this is a lot. And so for me, I'm looking forward now, even though we're right here in the moment, but looking forward is something we always have to have top of mind, at least for our family.
And that's good advice for any parent watching. Dr. Crawford?
Yeah, so, you know, I think I say this on every show, but the best part of my job is you get to meet these incredible individuals. And, you know, someone like you, a liver transplant, on chronic immunosuppression, now undergoing open heart surgery, you have a pacemaker. A lot of these things could define you, but they don't. You know, you are such an amazing individual, and I think that's really special and unique. And that's why I think your message to the rest of patients that may be facing a similar predicament is neat, because you've pushed through all this adversity and you're living your life.
Is the liver, did what happened with his liver as a baby have anything to do with this, or are these just two completely separate events?
I think, unfortunately, just two separate unfortunate events. Both things he was born with.
And the universe knew you could handle it.
Boy, we're on life number whatever now.
My
So it's
goodness.
gonna keep going.
We are so grateful. We're so grateful, Kim, that you wanted to come on this program, and Luke, for
Thank you
sharing
for
your
having us.
journey.
Absolutely. Thanks
You're
for
going to help
having
so
us,
many people.
Alexis.
And Dr. Crawford, I know you want to get upstairs and hold your little baby.
Yes.
So you can go be a doctor now and dad. We're going to close out this program. Thank you so much for watching us today and being with us. And if you'd like to watch or share any one of our previous episodes, just scan the QR code that's on your screen right now. That will take you to a list with links of all of our past episodes. Coming up next week on All Things Heart, you are watching History in the Making, the first patient ever at the University of Kansas Health System to walk while on VA ECMO. His remarkable story of survival and why surfing is in the near future for him. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. What started as a stomach ache was actually gastric cancer. And despite a stage 4 diagnosis, Austin Hill found hope in immunotherapy. I'm Jessica Lovell on the next Morning Medical Update. The path from grim diagnosis to a cure. What it means to stop treatment after years of therapy. Friday at 8.